Mark Bishop Show. Truly like a box of chocolates. You never know who you're going to meet. From business, lifestyle, and fun. Here's Mark.
Welcome, everybody, to another Mark Bishop Show. You know, February, it's American Heart Month. Sad, 1 in every 110 babies born in the U.S. is born with a heart disease. About 25% of babies with CHD have a critical form and generally need an intervention during their first year of life. Look, that's sad. My special guest today on the show, she's a professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania. Million letters after her name. I won't read them because they don't fit on the tape. But she is a board certified in pediatric cardiology, ABP, adult congenital heart disease, ABIM, and also cardiac electrophysiology, which is IBHRE, and rhythm devices. So I'm referring to the one and only Maully Shah. Good morning. Welcome.
Good morning. Thank you for having me.
Okay, well, look, you know, we know as many as 1 in 110 babies born each year are born with congenital heart disease, but do we know why?
That's an excellent question. We do know that some forms of congenital heart disease are caused by genetic problems. Some may be caused by environmental factors, some due to medications taken in the first trimester when the fetal heart is just being formed. But many forms are sporadic and there isn't an identifiable risk factor. But this is a hot subject for research, and our understanding for causation will continue to improve.
So how are heart defects diagnosed in the first place and you know, treated with what symptoms show to you? Well, what would require a visit to a pediatric cardiologist?
So let's begin with the diagnosis very, very early on in life. Most heart defects are actually diagnosed in fetal life with a test called a fetal echocardiogram. This is an ultrasound to evaluate the anatomy of a fetus and is performed around 20 weeks of fetal life. Next, when the baby is born in the United States, there is a mandatory screening test for critical congenital heart disease that all babies get. This is called a pulse oximetry test. It's a simple test using a finger sensor to measure the baby's oxygen level. And after that, there are some forms of congenital heart disease that are detected a little bit later on in childhood. So for infants, parents can observe how the baby or the child appears. If the baby is appearing blue, gray, lethargic without any other cause, that could be a sign of heart defect. For older children who can verbalize their symptoms, often we are told about complaints such as shortness of breath, usually with exertion or exercise, fainting, chest pain. Sometimes patients without congenital heart disease have these symptoms, but when they occur with stress or exercise, that should prompt evaluation of the heart. There are other symptoms such as irregular heartbeats, fast heartbeats, swelling of the ankle and feet, not able to perform peer-level activities. And sometimes it just takes an astute pediatrician to pick up on an abnormal heart sound that then leads to the diagnosis of heart defect.
Right. Sounds a little bit of a gamble to me, you know, an astute physician, because, I mean, an irregular heartbeat, that's cardiac arrhythmia. Why do they occur, though, in the first place?
So you're right? So just an irregular heartbeat is not necessarily an important condition that would signify a serious heart defect. But there are irregular heartbeats that are very fast. Some are very slow. And these cause problems for patients to perform normal activities. And these are what we call true arrhythmias. A cardiac arrhythmia is essentially caused due to a disruption in the heart's electrical system. If it's sporadic or transient, then it could be benign. But for patients who have repetitive symptoms that interrupt their quality of life or cause more serious symptoms such as fainting, these should be treated and diagnosed promptly.
All right, yes. So for any new moms listening right now, don't panic. Lots of options yet. What treatment options, in fact, doctor, are available to the children who experience this irregular heartbeat, this cardiac arrhythmia?
The first, we're going to start with complete evaluation. And many children experience irregular heartbeats which are transient or modifiable by simple lifetime or lifestyle adjustments. These patients require some advice, evaluation, but don't necessarily require treatment, and these are not life-threatening. Now, patients who have very fast heart rhythms that interrupt their quality of life and sometimes may actually cause problems such as fainting, they require prompt treatment. Treatment strategies include medications to control the heartbeat, but then there are also curative treatments, one of which is a catheter ablation, a minimally invasive procedure, which involves putting a small tube through the blood vessels into the heart to create first a three-dimensional map of the patient's anatomy, and then also map out the patient's electrical system and pinpoint abnormal cells causing a fast heartbeat. These cells then can be targeted with a catheter and destroyed using hot or cold energy. And in most cases, this provides a permanent cure such that the child will never experience this again. There are also some patients born with slow heart rhythms, and these patients, if they are symptomatic, may require implantable devices such as pacemakers.
Well, I mean, on the other side of the coin, it's good news, the expected long-term outcome for babies, who do undergo a cardiac intervention. What do you think about the future for overall for cardiac treatment and the interventions as it stands right now? I mean, advances apparently in prenatal diagnosis and imaging have allowed for early treatment for babies with birth defects like congenital heart disease. Do you go along with that?
I think the future is extremely bright. We expect over 97% of our babies, infants with congenital heart defects who've been treated to survive into adulthood and lead perfectly normal lives with an excellent quality of life. There are various innovations and advances, and I'm so excited about the future of cardiac care. As you mentioned, from a diagnostic standpoint, there is fascinating imaging, which includes 3D modeling of an individual patient's heart to improve our understanding of the child's individual anatomy and heart condition. This is helpful in customized approaches to repairing heart defects. Many procedures now are minimally invasive and actually replace cardiac surgery. And these include catheter-based interventions to close holes in the heart, replace or repair valves. And then there are sophisticated game-changing technologies to cure heart rhythm abnormalities. And we're now even embarking for certain rare genetic inherited conditions, we're embarking on gene therapy clinical trials that will cure the disease at the root cause and not just modify symptoms.
Yeah.
So the future is very exciting.
Isn't it? When you talk about that, that's this infamous CRISPR technology, yes?
Yes.
Yeah, marvelous. Get it before it even starts. That's the way. Marvelous. The Cardiac Center at the Children's Hospital of Philadelphia, affectionately known as CHOP, that team there, folks, performs more than 950 pediatric heart surgeries a year. They come from all over the place, all over different countries as well. And this includes open heart and closed heart procedures and heart transplants. Man, what a busy place that is. Well, Dr. Maully Shah, you do a wonderful job. Thank you so much for all you put into all of this and the future of our little ones. They're the future of our country. Thank you. You do a great job. Keep it up. Oh, by the way, chop.edu/heart. Is that correct?
That's correct. And thank you very much for having me today and spreading congenital heart disease awareness.
You're most welcome. It's always a pleasure to have someone from CHOP. Thank you. Goodbye now.
Goodbye.
Join us us again for another episode of The Mark Bishop Show. It's a production of Mark Bishop Media.